In this video, we'll take a look at Medicare Part B. Medicare Part B is the part of Medicare we associate with most, one's healthcare costs. Medicare Part B covers everything medical, including costs in the hospital such as surgeon fees and all medical costs outside of the hospital such as doctor's appointments, labs, MRIs, etc., as well as durable medical equipment. Part B enrollment is handled through Social Security. You have a 7-month window around your 65th birthday to enroll into Part B. Medicare gives this very wide window in part to allow time to understand how Medicare works, to talk with an agent to review options that best fit your needs, and time to select an insurance plan for additional coverage. The 7 months includes the 3 months before your birthday month, and the 3 months after. The best time to enroll in Medicare Part B is the time prior to your birthday, unless you are continuing to work and/or have employer coverage past age 65 and defer your Part B enrollment, something we'll cover in this video. If your 7-month open enrollment window is missed, you may have to wait until the general enrollment period, which runs each year from January 1st through March 31st for a Medicare effective date of July 1st. The cost? Medicare Part B has a monthly premium which can change annually. Now, if you are in a higher tax bracket, your premium could be higher. The monthly premium is based on income and for most is deducted directly from your Social Security check. If you are not drawing Social Security, you can choose to pay by automated bank draft or be billed quarterly. It's important to note that what you pay can vary from year to year. Medicare can raise the Part B premiums each year, and because the premium is based on a person's modified adjusted gross income as reported on their taxes 2 years prior, a person selling their business or home this year, for example, may pay a higher amount 2 years later. But keep in mind, in this example, the Part B premium could go down in the future if your income settles down and evens out. Okay. So what coverage comes from paying that Part B premium? Generally speaking, Medicare will cover what is deemed medically necessary. Now this includes physician and specialist services and the equipment they use to treat you. It will cover outpatient care, durable medical equipment, which includes things like oxygen, wheelchairs, walkers, CPAP machines. It covers preventative services and screenings, physical therapy, and physician-administered drugs, sometimes referred to as Part B drugs. Now, some chemotherapy drugs and cortisone shots for arthritis are examples of Part B drugs. If something is optional or elective, Medicare will not cover those services. Medicare will not cover things like routine vision or hearing, glasses or hearing aids, alternative health care, routine chiropractic care, prescription drug coverage, custodial care or dental care. And Medicare does recognize medical diseases and conditions of the eye and will provide for coverage in these instances, even covering glasses after cataract surgery. It's important to note that there is no coverage outside of the United States. And here in the United States, providers must accept Medicare assignment and be accepting new Medicare patients. Otherwise, services may not be covered. Now, we have talked about the premium and which services fall under Part B. The question then is, what costs are you responsible for? Medicare Part B has a deductible and cost sharing. Currently, there is an annual deductible to pay before Medicare comes in. Once the deductible is met, which is generally done with your first visit to see your doctor each year, Medicare covers 80% of assignment, which is the set reimbursement rate Medicare assigns for services performed. This leaves a 20% coinsurance for the patient to pay. A small annual deductible and a plan that pays 80% of medical costs doesn't sound too bad, right? Well, the concern with potential Part B costs is that there isn't a cap or out-of-pocket maximum for that remaining 20% that Medicare doesn't cover. If someone has a serious medical issue and spends the year going through cancer treatment or having surgeries for a heart condition, they could be facing out-of-pocket costs in the range of tens of thousands of dollars. That is a major crisis for most people who may not have savings large enough to cover these kinds of medical costs. Fortunately, there are insurance plans available to help offset out-of-pocket costs, provide additional coverage, and even completely fill in the gap between what Medicare pays and your share of the cost. That's what Medicare insurance plans are for, to provide a fuller coverage than original Medicare so that you are protected. Those options are reviewed in some of our other videos. We here at VibrantUSA are independent, trusted, and unbiased, and ready to serve you.